Good morning, everyone. Today, we will discuss regarding the second unit of social and preventive pharmacy, that is preventive medicine. So, in this preventive medicine, we will discuss about preventive steps for different diseases. In that, the first thing you see, the principles of prevention. There are only five principles of prevention. They are first one, health education. Health education, as we have discussed earlier in the first unit, health education, educating the people regarding the health. If a people is having good education regarding health, then they can maintain their health very easily, and they know how to prevent the diseases. Like that, the people have to adapt the environmental modifications, and they have to maintain nutrition and good lifestyle changes, and taking immunization means maintaining immunity against some diseases. So these are the steps which are mainly involved in the principles of prevention. And the first disease we will deal about, that is prevention of cholera. So what is cholera? Cholera is caused by Vibrio cholerae, which is a gram-negative bacteria. The symptoms of cholera are severe dehydration and diarrhea. The body will lose the fluids, the patient body will lose the fluids, and he will get loose motions, and no urine production will be there, and cardiac failure will occur in some cases. So these are the symptoms of cholera. And transmission of cholera, mainly the cholera is transmitted through stool and vomit of an infected person. The vomit and stool of infected person can carry the cholera. The flies which will lie on this stool of an infected person, when this fly goes and lies on any food material, if that person takes the food material, then the fresh person will also get this cholera. And diagnosis of the cholera includes mainly, in diagnostic test, we have to find out the specimen, stool specimen, and a rapid diagnostic test is performed, and a serological test is performed for knowing about cholera, for diagnosing the cholera disease. And treatment includes mainly rehydration by the fluids. So the patient should take more and more fluids through rehydration mechanism, and also IV fluids are provided through intravenous route, and antibiotics are given for treating this cholera. Antibiotics like orfloxacin, ciprofloxacin, trimethoprim sulfamethoxazole, doxycycline, and azithromycin antibiotics are given for treating this cholera. Along with that, zinc supplements will also be provided with oral rehydration salt. Prevention. So how to prevent cholera? Mainly by taking safe food material. The vegetables should be washed once or twice, and the human beings have to take only cooked food material, and safe drinking water, and public health measures like public health sanitation. And there are vaccines which are available for cholera. There are two doses of vaccines the people have to take. The two doses of vaccines names are Bicoral vaccine, Shankal vaccine, Uvicol vaccine. These are available for immunizing of cholera. And chemoprophylaxis treatment is also done with tetracycline antibiotics. This is regarding prevention of cholera. And next one is prevention of SARS. SARS, severe acute respiratory syndrome. SARS is severe acute respiratory syndrome. The symptoms of this SARS are high fever, dry cough, sore throat, headache, body ache, hypoxia. Hypoxia means nothing but breathlessness. Means what? The patient cannot breathe properly. He cannot breathe properly. And kidney and heart failure. And transmission, how the SARS is transmitted? Mainly by saliva exchange. Saliva exchange in the sense through droplets of saliva, and also through kissing process and skin to skin contact, and by touching the contaminated surfaces where the saliva is present, by sharing the same utensils, and by speaking with the SARS affected person within 3 feet distance. These are the things which will transmit this SARS. And diagnosis of SARS mainly includes blood test. In blood test, if there is an increase in lactate dehydrogenase levels, then it confirms the SARS. And increase in creatine kinase levels will also confirm this SARS disease. And sputum test is performed for knowing the SARS. If the sputum test confirms that if it is negative for pneumonia and influenza, then it indicates that the patient is having SARS. And also chest x-ray is performed for knowing if there is any shadows in lungs. The patchy shadows in lungs confirms the SARS. And treatment for SARS disease is the broad spectrum antibiotics like doxycycline and minocycline is given, and antiviral agents like acyclovir and amantadine are given, and immunomodulatory therapy is provided for treating these SARS cases. And prevention of cholera mainly includes maintaining proper hygiene standards and do not touch nose, mouth, eyes, and frequently. Why? Because if your hands are if your hands are infected with this droplet virus, then it may transfer through your nose, mouth, eyes frequently. And avoid close contact with the SARS sick people and don't touch surfaces where these droplets will be present. And also cover face with your mask and hands with gloves and quarantine and isolate the patient who affected with this SARS. And there are no vaccines up to now available for SARS. And next one is prevention of influenza. Influenza is also an upper respiratory tract infection, which is mainly caused by orthomyxo type of RNA virus. Symptoms of these influenza are high fever, chills, diarrhea, abdominal pain, sore throat, bronchitis with cough. Bronchitis, itis means always swelling. Itis means inflammation. Inflammation of bronchi is called as bronchitis. This leads to cough, and these are the symptoms of influenza. And transmission of influenza mainly done by it spreads from person to person through droplets. And regarding diagnosis, mainly IgG antibody test is performed for diagnosing this influenza, and also immunofluorescence assay is performed for confirming this influenza virus. And the next one, treatment of this influenza. Mainly, most of the people does not need specific treatment for the influenza. Mainly, the patients will recover within 1 to 2 weeks, but only some patients develops these pneumonia symptoms. For them, we have to provide antiviral therapy with oseltamivir and zenamivir, and antibiotics like gentamicin, metronidazole, and cephalosporin are given, and flu vaccine. The flu vaccine is providing for developing the antibodies in the body, and quadrivalent influenza vaccine will also protect against this influenza virus. Prevention of influenza mainly avoid bad ventilated places where we get bad smell and keep safe distancing from the people, stay at home mostly and keep isolated from other people, avoid overcrowded places like markets and maintain proper hygiene conditions, cover your nose and mouth when sneezing, and frequent hand washing is highly necessary. Quit smoking and alcohol, which are injurious to your health. And next one is chikungunya. Chikungunya symptoms. What are the symptoms of chikungunya? Mainly high fever, vomiting, joint pains, and swelling at the joints. This is the main symptom of chikungunya: joint pains and swelling at the joints. And transmission. How the chikungunya is transmitted? Chikungunya is mainly transmitted by Aedes aegypti and Aedes albopicus mosquitoes. These two mosquitoes transmits this chikungunya. And diagnosis of chikungunya mainly involves if the patient is having severe joint pain. By physical examination, the doctor may confirm it as chikungunya. ELISA test is performed. ELISA test means enzyme linked immunosorbent assay test. And RT-PCR test and immunofluorescence assay is also performed. And treatment mainly includes non-steroidal anti-inflammatory drugs are given, analgesics, the painkillers are given, and OTC drugs are given for treating this chikungunya. Example of drugs involves ibuprofen, acetaminophen, naproxen. And prevention of chikungunya mainly avoid mosquito bite, dump out the standing water which is there around your home, empty the unused containers of water, and there is no vaccine which is available for treating this chikungunya. Dengue, it is one of the important disease nowadays. Symptoms of dengue are mainly high fever, abdominal pain, skin rashes, liver enlargement, and decrease in blood platelets. Decrease in blood platelets is an important symptom of this dengue, which confirms dengue. Transmission of dengue is done by mainly Aedes genus mosquito bite. It is also transmitted by mosquito, that is the name of that mosquito is Aedes genus. It mainly bites during daytime, rarely bites women. Rarely the dengue is caused from woman to child. Diagnosis of dengue mainly involves physical examination, low platelets and low WBC count, and a less plasma value and albumin may indicate it as dengue. Treatment of dengue, mainly pain relievers are given, fluid therapy is provided for regaining the platelets, and in severe cases, transfusion of blood cells is done. And dengue vaccine is the vaccine which is approved in 20 countries for treating against this dengue. Prevention of dengue, mainly avoid mosquito bite, reduce the stagnant water which is there around your home, drain the stored water of your home, and clean the overhead tanks of your home regularly so that no mosquitoes can lay its eggs in water, and coolers should be dried and kept aside. And next one is pneumonia. The symptoms of pneumonia, you know very well, that is excessive sweating, chest pain, and bloody mucus. Bloody mucus is one of the main symptom of this pneumonia. Transmission is mainly done by a virus named as rhinovirus. The transmission is done through droplets of infected person. Diagnosis of pneumonia mainly includes blood test, chest x-ray, and pulse oximetry. Pulse oximetry is mainly done for knowing the oxygen levels of the human being, and CT scan is done for image of the lungs. And treatment mainly includes antibiotic treatment by azithromycin and clarithromycin. Antiviral treatment is done by Tamiflu, Relinza, and Pamivir drugs. And cough relievers are given for treating the cough, and analgesics are given for treating the pain. And prevention of pneumonia mainly prevented by washing the hands regularly, eating good balanced diet, quitting the smoking and alcohol, drinking lot of fluids, taking vitamin C and zinc tablets, and vaccines are available like PCV13 and PPSV23. These can prevent pneumonia. Next, Ebola virus. Ebola is one of the dangerous hemorrhagic virus. The symptoms of Ebola, it is occurs in 4 stages. In the first stage, after 7 days of virus entry, the first stage will occur. In this first stage, the symptoms like joint pain, fever, and headache will occur. On 10th day, the second stage will start. In that stage, the patient will get diarrhea, blood vomiting, and high fever. On the 11th day, the third stage will start. The third stage, they will get the symptoms like brain damage, bleedings from the nose, mouth, and anus. From mouth, nose, and anus, the blood will start to flow on 11th day. On 12th day, fourth stage will start, and the symptoms are coma, organ failure, shock, and death. And this Ebola virus is mainly transmitted through contact with bats or other primates, which transfers this virus. Diagnosis is mainly done by taking the blood samples and checking for viral RNA, and PCR test, polymerase chain reactions, and enzyme-linked immunosorbent assay will confirm this Ebola virus. RT-PCR test will also confirm this Ebola virus, and electron microscopy will also be done for confirming this Ebola virus. And treatment mainly involves oral rehydration is done for rehydrating for gaining the fluids of body, and monoclonal antibody therapy is also provided. It is in experimental stage, and RNA based drugs like favipiravir and KM Ebola AVI 7537 are given, and immunomodulators are provided, and vaccines like Ervebo vaccine is provided for preventing this Ebola virus. And prevention steps involves mainly avoid contact with Ebola infected people, avoid funerals of Ebola infected person. If any person dies with this Ebola virus, don't attend the funeral of that person. Why? Because the dead body may transmit this infection. And avoid contact with bats, avoid raw meat of animals. Don't eat raw meat of animals, only eat cooked meat. And doctors should use some special protective clothes for preventing this Ebola virus, and hospitals should maintain some specially trained staff for preventing the exposure of the virus. And next one, malaria. The symptoms of malaria are mainly elevated temperature, night chills. The patient mainly gets chills at the night time, dry cough, back pain, sweating. And transmission mainly done by a mosquito named as female Anopheles mosquito. And diagnosis is mainly done by using blood test, platelet test, PCR, which determines the Plasmodium vivax. And CT scan is also done for knowing cerebral edema, if any edema is present in cerebral region. These are the diagnostic steps. And treatment mainly involves mainly chloroquine, primaquine, quinine, and artemisinin are given for treating this malaria. And prevention of malaria mainly involves applying some insect repellents to the skin, because the mosquitoes cannot beat the skin with insect repellents, and spraying some repellents on clothing, and wear socks, long pants, long sleeve shirts to avoid mosquito bite, and use some mosquito nets to avoid mosquito bite. Spray pyrethrin in bedroom before going to bed so that the mosquitoes cannot bite you, and make sure that room doors and windows are closed so that the mosquitoes cannot enter into your home. And the next one is acute respiratory infection. The types are upper respiratory tract infection and lower respiratory tract infection. These are two types of respiratory tract infections. Upper respiratory tract infections mainly causes common cold, pharyngitis, laryngitis, tracheitis, and epiglottis. Lower respiratory tract infections mainly cause bronchitis, bronchiolitis, and pneumonias. And causes for these infections are They're mainly caused by pathogens, pollution, and a lack of immunity and malnutrition. And symptoms of these acute respiratory tract infections are runny nose, cough, sore throat, body aches, and fever. These are the symptoms of this acute respiratory tract infection. Diagnosis is mainly done by physical examination. If the patient is having redness of eye and throat infection, then he may confirm ARI, and throat swab is taken. A cotton swab from throat is collected for checking the infectious matter, and X-ray is performed for knowing the condition of the lungs, and CT scan is performed for knowing the sinusitis, and a lungs function test is performed for knowing the functioning of the lungs. And treatment is mainly done based on the classification whether it is by bacteria or by viral. For bacteria, antibacterials are given like amoxicillin, penicillin, erythromycin, and azithromycin. For viral, antivirals are given, that is amantadine and ribavirin. And along with that, analgesics and nebulizer treatment is also provided for required patients. And prevention of ARIs mainly is done by vaccination. The vaccines like MMR vaccine, influenza vaccine, and pertussis vaccine may prevent this ARI, acute respiratory infection. And also by practicing good hygiene, washing your hands frequently, covering the mouth and nose during sneezing, and avoiding touching the face, eyes, and mouth, avoiding alcohol, maintaining balanced diet, and using face mask and drinking plenty of fluids, and keeping the house ventilated may prevent this ARI infection. Next one is filariasis. Filariasis, the symptoms of filariasis are mainly shaking, chills, high temperature, swollen lymph nodes. The lymph nodes will swell, that is called as swollen lymph nodes at a joint portion, and lymphedema of lungs, swelling of legs, arms, breast, etc. Transmission is mainly done by mosquito bite with parasite Wuchereria bancrofti and Brugia malai. These are the two parasites which will transfer this infection. The diagnosis is mainly done by taking the blood samples collected mainly during night period. Why? Because this microfilaria appears only during night period in the blood. And also by detecting by IgG in blood, IgG antibodies in blood will also confirm this filariasis. Treatment is mainly done by anti-parasiticide drug, that is diethyl carbamazine. This diethyl carbamazine is given with a combination albendazole for treating this filariasis, and also doxycycline is also used for elephantiasis. Prevention of filariasis is mainly done by preventing the mosquito bite, then distracting the mosquito breeding sites. Wherever the mosquito breeding sites are available in your house area, you just distract those mosquito breeding sites. And the affected limbs should be mobile every time, should be moved every time. And wash and dry the swollen areas and disinfect the wounds with some antifungal and antibacterial creams. This is about filariasis. So totally this is regarding preventive medicine, that is second unit of your social and preventive pharmacy. And along with this, we are also having diabetes, hepatitis, and cancer, which we have already discussed in pathophysiology subject of second semester, which we have already studied these topics. So this is about preventive medicine, that is of second unit of social and preventive pharmacy. Thank you. Jai Hind.